Recent studies in NPWT have examined microvascular blood flow at varying levels of negative pressure and for varying duration. Researchers at the Lund University Hospital in Sweden used laser Doppler technology in 2 pig wound models to conduct a detailed analysis of microvascular blood flow at varying distances from the wound edge and in different tissue types. In their studies, increased blood flow was observed in tissue immediately surrounding the wound edge. However, a zone of hypoperfusion with reduced blood flow was also seen. When higher negative pressures were applied, the zone of hypoperfusion increased, causing greater concern of ischemia, an insufficient supply of oxygenated blood, which can lead to tissue death. For optimal wound healing, a balance is needed between adequately increasing blood flow while reducing edema and minimizing possible ischemia. The Lund authors propose pressures of -75 millimeters of mercury for subcutaneous tissue and -100 millimeters of mercury for muscular tissue. In further studies, the researchers also explored beneficial effects of intermittent pressure. During intermittent therapy, subatmospheric pressure was turned on and off repeatedly at set intervals. In the zone of hypoperfusion near the wound edge, each time the pump was turned off, increases in blood flow were observed that rose 40 to 50% above baseline levels and persisted above baseline for several minutes. They noted that rhythmic perfusion of tissue seems to stimulate development of new blood vessels and other cells important to healing, and may be much more effective than continuous pressure. As a result of this and other research, lower negative pressures and the use of intermittent pressure are increasingly considered by scientists and clinicians to be ideal for NPWT.